Hello, I am Dr. Rajasekhar from Chirag Institute of Proctology in JP Nagar, Bangalore, which was started 25 years ago to give the best of services in the department of proctology for piles, fissures and fistula. I will be talking about what are the different types of piles, what are the different types of management for a common man to understand, to remove so many myths and so many confusions in the treatment and in the concept of piles. So let us start with water piles. Piles are nothing but bunches of blood vessels arranged in three groups inside the anal canal. They are called anal cushions, which act like valves to prevent escape of air and all. They are normal structures. Due to some reasons like constipation, applying lot of pressure, sitting for long periods, very spicy food, smoking, etc. When the pressure is more blood flows into those normal structures and they start enlarging. Then we call them as piles. So there are two types of piles basically. One is internal piles, external piles. Internal piles are there inside the anal canal and they are not normally seen unless they are very much enlarged. External piles are near the anal canal under the skin and they are seen outside. They are called external piles. Both are bunches of blood vessels. So now, what are the different stages of piles? Basically, internal piles, there are four stages. One is called stage 1. In stage 1, the piles remain inside. You can't see from outside anything. And then occasionally they will be bleeding. So what people think in terms of heat, that is all, most of the time it is first degree piles. So first degree piles, the treatment for the first degree piles is only medical treatment and some lifestyle changes. There is no need for any surgery or interventions required in first degree. But many people will not come in the stage thinking that it is because of heat. They try home remedies and all, which is not good, because bleeding from anal canal may be because of some other reasons, including cancer. So you always better get it checked for the diagnosis purpose. Diagnosis is very important. So the next stage is called second degree, where the piles become much more bigger. When the patient applies pressure during passing stools, it pops out and goes back without any effort. They are called second degree piles. Third degree piles come out when they apply pressure and it has to be pushed back or slowly goes back. They are called third degree. Fourth degree is they remain outside. Internal piles remain outside, you can't even push it back. Similar structures outside under the skin, as I told you, is called external piles. Now what are the treatment options? First degree, anyway, there is no surgery is required if the people come at an early stage. Second degree, we do very minimal procedures like infrared coagulation, wherein we just seal the main supply to the piles from inside. There won't be any cutting of the tissues, there won't be any stitches. Hardly it takes about 5 to 6 minutes procedure and patient gets rid of the piles permanently. Whereas third degree is much more bigger, it comes out, it has to be pushed back. So those require surgical procedures. And in that there are two types of surgery where there are cutting, removing and all, what we call as excisional procedures, where there will be really painful conditions. Whereas we do differently, using some different gadgets for that. For third degree we use something called Doppler guided hemorrhoidal arterial ligation. Each pile mass will have one or two main blood vessels supplying to it. Using a Doppler guided proctoscope, we locate the main vessel from inside the anal canal and then stitch it up, close it off. The supply is cut off, so the piles will start shrinking and that takes care of the piles. In the fourth stage, it is much more bigger and many times it will be associated with external piles also. So after ligating the vessel using Doppler, in the fourth stage we use lasers also, latest type of equipment which are available for the treatment of hemorrhoids or piles. So we will put that specialized tip of laser tip into the extra pile masses, into the external piles, or which have not become smaller after doing the Doppler procedure. So we will introduce the tip into that and on the laser. So the laser energy will make it shrink. And so in all these procedures, there is no cutting of tissue, there is no removal of tissue, there are no wounds. And then the bleeding is very minimal, negligent bleeding will be there. And it is very painless procedure. The advantages of doing this sort of procedures compared to conventional procedures like hemorrhoidectomy and rubber band ligation and all, One is the surety of the procedure, the chances of recurrence will be very, very less. All these procedures are done under local anesthesia, so there is no need for taking injection into the back called spinal anesthesia or general anesthesia. And all are done under local anesthesia. They are all done in a single sitting, and then it is all a daycare procedure. Patient comes in the morning around 9 o'clock and goes back by 4 to 5 o'clock in the evening. Most of them will be able to go back to their work within a day or two, and they will be able to sit comfortably. There is no need for taking bed rest and all that. And post-operative pain, bleeding are very, very minimal compared to regular surgeries. And they have revolutionized the treatment of hemorrhoids for the past 5 to 10 years. There is a lot of improvement, and patient need not worry about the pain and complications and recurrence rates of piles.